Judy, can you give me an introduction about yourself?
Yes, I'm Judy Marie Manuel. I'm from Ilocos Norte, age of 25, and I'm single, available, and ready to mingle. And yes, of course, I'm graduate of nursing for 4 years. But I forgot to mention that I failed once, but I took it again. So now I'm a registered nurse now. Not even work in any hospital, but I work in as a private nurse.
February 12 to February 13.
Yes, ma'am.
You work in Philippines for
Yes.
Mrs.
Farinas.
Farinas
Yes, ma'am.
as a private duty nurse.
Yes, ma'am.
How many nurses are there in this house?
We are three in different shift, ma'am.
3 different shifts.
Yes, ma'am.
How long is your duty?
It's 10 almost
So
10
you
hours,
don't,
ma'am.
you don't stay with your employers?
No, ma'am.
You don't stay?
Yes, ma'am.
No, you can stay in Singapore because you are coming to Singapore. You can't go back right every day. So you will need to stay in employee house. But do you mind sharing rooms with any children or any like patient?
Yes, so it's okay to me, ma'am.
It's okay.
What I'm doing in my shift is give her meds, assist when she go to bathroom, and I give her med, and then I massage her as she goes sleep.
So the patient, sorry, I forgot to ask, how old is the patient?
I 83 years old.
83 years old. Is she completely bedridden or
No, sir. She barely can't walk because there's something
barely
with
can walk? Okay.
her knee.
So she have a cane with her?
Yes,
Walking stick?
yes.
How-
She will rise in a wheelchair.
Do you need to carry her, like to move her from one place to another?
Yes, ma'am. I usually do that with a proper body mechanics. She has an hypertension, ma'am, but all I know is there is something wrong with her knee, so that's why she
Give her
can't walk.
medicine, massage for the patient, assist her going to washroom. How do you massage the patient?
From every side, there's such a time to massage, like 10 minutes here, 10 minutes in down, then the other side 10 minutes, 10 minutes.
Are you required to help her to change diapers?
No, ma'am. Only to help her to
To
take
the toilet, even in the night time?
yes. From 7 p.m. to 5 a.m. I usually
So
with her.
Can she bathe independently?
No, ma'am. Cause she can't do such thing like going up and stand
question?
alone.
If let's say your employer is a completely bedridden person, okay, I'm sure you've undergone this training before. If let's say it's completely bedridden, when she needs your help to clean her, you need to change diaper for her, you know.
Yes.
Do you mind doing that?
Yes, I will
The
do
patient
that,
needs you to go and clean around their
Clean their-
vicinity, their room,
Yes.
you know, because depending on the condition of the patient, sometimes you might be required to do, if it's not totally dependent on you, you might be required to do some other, you know, housework and all that. Are you familiar with doing? Are
Yes.
you okay with doing it in the first
Yes,
place?
yes, sir. Because I'm also familiar with that. I'm also working with the household in our house, sir.
In your own house, right?
Yes, yes, sir.
So like basic cooking and cleaning, are you able to do it?
Yes, sir.
Cooking you know how to cook,
Yes, sir.
Okay.
How you cook? What kind of dishes?
Yeah.
Other than telling me Filipino.
I can cook chop suey and pancit canton, pancit bihon.
Bihun.
Yeah.
Okay. Ramen.
Okay, then
And fried rice.
do you know how to take care of newborns, infants?
Yes, barely can handle it.
You can belly.
Barely can handle. Not totally handle all the needs of a baby, but I'm willing to.
You are willing to learn.
Okay, when you work in Philippines, you'll be working on shift like 12 hours, that kind of thing. But when you go to Singapore to work, it's a different thing altogether. It's a 2-year contract. Sometimes they will not even give you any off day. But okay, depend on the condition of the patient. Sometimes if the patient requires, or even the baby or the employer requires your presence or your support 24 hours, you know,
Yes.
like no off. But maybe they will still let you take a break once a month.
Only once
Okay.
a week or once a month. At least they will give me a
So
off.
just to take a break.
Yes.
So let's
Okay.
say your patient happen to get out of breath or they need CPR or even when they need tube feeding. Do you know how to do all this?
Yes, I've already done that, ma'am. Actually, I already have an training for basic life support here, ma'am, and first aid training also, ma'am.
First aid training.
Yes.
So do you have anything in mind that you want to tell your
Say.
prospective employers about why you want to go Singapore?
Of course, the salary to help my parents and my prospective with my employees. They are good to me as I work with them and respect and kindness to me.